Hi, I'm Dr. Lynn Michael. It's nice to be here again, and today I'm going to talk to you about sleep. So, we have a new sleep product called Sleep Synergy Plus, and it's a product I've been using for the last couple years, and it's really effective for helping my sleep and my patients' sleep in general. So, I first wanted to talk to you about sleep, and as a doctor, I would say at least 35% of my patients have sleep issues. I personally have had a lot of sleep issues, and my sleep started being disrupted about the time my first husband got very ill with cancer. So that was a very stressful 2 years, and it was very difficult to sleep and relax. Actually, watching someone when they're ill is called night watching. And it was a time where my sleep was very disrupted. I was on edge, kind of worried. And it was never the same since that time. After he passed away, I found that with my next husband, it triggered even poorer sleep. Just having someone in the bed with me made me really anxious. It was difficult to relax. It's sort of like the trauma from that first experience when my sleep got disrupted returned. So I find that, you know, people have their own experience with why sleep becomes disrupted, but often there is some trigger from the past, even childhood trauma, time of great stress, and the birth of a new child. A lot of those things can sort of be a catalyst, or sort of maybe the straw that breaks the camel's back that puts us into some imbalance that causes that sleep disruption. Of course, when people travel and they change time zones, that can be a time when your sleep circadian rhythm is off. Again, when you have a new baby or a difficult situation, watching someone be sick, that can disrupt your sleep. Stress in general, during that time, my husband was ill, I was also at Bastyr, and I was under a great deal of stress studying, trying to use my brain, trying to manage my home, dealing with grief. So sometimes life is just overwhelming and there are a lot of things to deal with. So that stress is a contributor. It's hard to turn your brain off to help your muscles and your body relax. And hormones can be an aggravation to sleep in that they kind of exaggerate what's already going on. So if you have some imbalance with stress, or you travel a lot and you're changing time zones and your hormones are changing, this perimenopause time or even that PMS time, then that can sort of aggravate or accentuate the imbalance. And a lot of people have just poor, what I call sleep hygiene. They are up too late at night, reading or watching TV, stimulated by their computer or their video games, and that stimulation from the light in our devices seems to promote more dopamine, kind of turning our brain on, kind of getting us stimulated. And when you do a lot of that in the evening, it's there again very hard to kind of suppress those hormones or endorphins that have been stimulated, and so sleep is difficult, or it can be interrupted. So a lot of people come in with some or all of this in their past, and sleep's a big complaint. They want an immediate answer, a quick fix. Of course, the pharmaceutical medications are, sort of a quick fix. Often they do sort of knock you out, but a lot of them have side effects that people don't like. The over-the-counter medications actually over time can have some damage to your brain and even contribute to memory problems and degeneration in the brain. And some of the other stronger ones like Ambien and that kind of thing can cause some really significant and kind of scary side effects for some people, like getting up in the middle of the night not knowing what they're doing. So we can go to those options, but a lot of people would like to find something safer with less side effects and something they can count on to not cause carryover effect the next day. Before I jump to supplements, I always talk about, lifestyle, what's going on for that person. And of course, if you've listened to any of my videos, diet is sort of an underlying cause or part of our health that I like to address. When people are eating a lot of high carbs or sugar in the evening, that can have an influence on interfering with sleep by spiking your blood sugar and insulin and then dropping pretty dramatically a couple hours later. If you are waking in the middle of the night and hungry, or find that if you eat a little bit, it helps you go back to sleep, that's probably a signal that the carbs are too high at night or you're having insulin problems, and you should probably focus on something more like protein and fat. They keep your blood sugar stable a lot longer and will kind of sustain your sleep through the night. A lot of people are in pain when they sleep. Their back hurts, their hips hurt, they hurt when they move or turn around. So taking away those inflammatory foods like wheat, dairy, and sugar, the ones I think promote to inflammation quite frequently in our American diet, decreasing those, getting those out of your diet will generally help body pain and sinus congestion or inflammation. So both of those things will be conducive to better sleep. Balancing your endocrine system and your nervous system is probably why we're not having good sleep most of the time. Again, kind of like I described in the beginning, what's going on with your life. So taking time during the day to figure out how to be calmer, to take breaks, so you disrupt that go, 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 and just take time to have 20 minutes out for a meal, or have a coffee break, or take time to go do a 20-minute walk, taking time to exercise, being out in nature. I don't know how many of my patients really can tell me they sit down for an hour in the evening and read a book. A lot of times we just think we don't have time, but if we don't make time, it contributes to this nervous system, endocrine system that's, on alert and doesn't know how to shut down and relax. So retraining yourself, making that a priority and learning how to do that, and then seeing the benefit will motivate you to keep those kind of disciplines or opportunities in your life going. Dealing with emotion. How many of you have had a time at night where your mind just won't shut off? The ideas keep flowing. You're thinking about your kids. You're thinking about your elderly parents. Something someone said to you at work. The next trip you're going to take. Your mind just won't shut down. Or it might be, a conflict that came up, so you keep replaying it in your mind. Dealing with our emotions, having a language to identify the feelings that are going on is really important. You can't do anything with this energy that's accumulating in you if you can't identify what the feelings are that are getting stirred up. And then if you do, you have an opportunity to express that to someone, write it down in a journal, process it a little bit. Feelings like to have attention. They like to be identified, and when they are identified and expressed, they are more likely to just kind of move on. But often we don't. It's, our own perception, it's our own story we keep replaying inside, and we don't share it until maybe we, blow up or break down. So having, developing tools for that, dealing with your emotion is really important for sleep, because we're close to our unconscious at sleep. When we're shutting down, our unconscious starts coming up, and what we've been able to suppress all day by being busy starts surfacing. And then more self-care. I guess this is kind of a synopsis of everything I was talking about, but taking a bath, exercising, taking a nap, restorative care. I had a mentor when I was at Bastyr say, what modality are you going to use to put people in a parasympathetic state of relaxation? Because that's when people heal. And I just thought, well, she was an acupuncturist and I wasn't, so I think she was challenging me, but I was learning cranial sacral therapy at the time. I had a massage license. I had a master's in psychotherapy, so I sort of felt like I had some tools, but it brought it to my attention that I need to use those tools and integrate them in my practice and in my own life, so that I could be, so I would have that support that's conducive to healing. And we heal when we sleep. I don't know how many of you had mothers that when you're not feeling well, they put you to bed. That is really when we restore, when we repair, when the body regenerates, is when we're in that deep state of relaxation. We're, not busy, our muscles are relaxed, but then all of our energy can go to this restorative nurturing sleep, which is why it's so distressing when you can't sleep, because you actually feel sort of that metabolic breakdown. So our product, the Sleep Synergy Plus, has a lot of good ingredients that really help sort of a lot of the areas that I've covered. One of the blend of herbs that are used, we have the valerian root, passion flower, lemon balm, and chamomile, have been used historically as nervines, which mean they're nourishing and gentle for the nervous system, help the nervous system repair, calm down, become more balanced. And they have that immediate effect. So you drink a cup of chamomile tea or you take the supplement. Within about 30 minutes, you feel that nourishing, kind of calming effect on the nerves. They do have also a restorative effect the longer you take them. So especially valerian has been known to have a more dramatic effect on anxiety the longer you take it. So I think sometimes people think they're just going to take the product when they can't sleep. But for people who have sleep problems, I recommend they take it regularly, probably for at least 2 or 3 months. L-theanine is another ingredient, an amino acid that promotes calmness, especially in the brain. The GABA is a calming neurotransmitter that is also an amino acid, so it's in this product. And this particular GABA is made from a fermentation process, so it's much more bioavailable and actually effective than some of the synthetic GABAs you see over the counter. It's a pretty common ingredient in supplements, but one thing I've learned about supplements is that quality really makes the difference. So this GABA is very good at calming the body, but especially calming the mind, kind of turning that monkey mind down or off, so that you can really just, kind of fall asleep and get into that rest. Melatonin, most people will say, oh, I've tried melatonin, it works or it doesn't work. But melatonin is actually a hormone like our estrogen and progesterone, and hormones are very important in cell regulation. So melatonin is really important for falling asleep, regulating circadian rhythm, supplementing and supporting our other neurotransmitters like serotonin. And so there is this correlation when people have long periods of poor sleep that they start getting depressed. Melatonin is partly responsible for that serotonin and that well-being effect. And there are numerous studies that show melatonin as an anti-cancer support. It has some influence on cell regulation, as an antioxidant, on protecting cells and the growth of cells, protecting you from the growth of abnormal cells, and is part of many protocols for cancer protection, especially the endocrine cancers like prostate and breast cancer. So when people are concerned about taking melatonin too long or even too high doses, I really try to put that to rest. It's probably more protective, and you have to get to a pretty high dose. I mean, the higher doses are really what they study as cancer protection. So a few people have vivid dreams with melatonin, and I've had probably 2 or 3 patients complain that they just couldn't take melatonin because it enhanced their dreams too much to the point of distraction. But I haven't really seen that when it's been in combination products. So, that might be something you look for. I personally like it when I start dreaming and can remember my dreams, but I don't have, they're not disruptive to my sleep. In fact, it's an indication you're in a pretty deep sleep. And this product also has 5-hydroxytryptophan, 5-HTP, which is a precursor to make serotonin. So serotonin is what we're enhancing with all the antidepressants, all the SSRI antidepressants, and it helps you have a sense of well-being, feel happy, it regulates your appetite. It has a lot to do with digestive health, and many people are deficient in 5-HTP or in serotonin. So this 5-HTP is not only supportive in staying asleep, but again, if you use the product for several months, it really can impact your mood. And I'm often giving people supplements with 5-HTP, but if they're getting it in their sleep support, I try to reassure people that it's also helping your mood, especially over time. And I see that it's very noticeable, and people usually notice that result fairly quickly, like within a week. Some shift. I mean, it's not huge, but even if it's a 25% improvement in your outlook in life, it can make a huge difference. And then if you're sleeping better, of course, you know, life starts looking better. It has some B6 in it, which is needed for that conversion of 5-HTP to B serotonin. So the B6 is important in that case, and that's why it's in there as well. So it's one of my favorite products. I really like it. I've been, you know, using it myself for at least 2 or 3 years. It's best to take it about 30 to 60 minutes before you want to go to sleep. So don't take it a couple hours, but you know, about a 30 minutes is good. Very seldom feel that hungover feeling. Sometimes if you take one at night, you still wake up 3 or 4 hours later. You can take another one. I've even taken it 2 hours before I have to get up. It still helps me fall back to sleep, and again, I don't have that hungover feeling in the morning. So it should, again, just be restorative, not really like to drug you out. And that's what I see my patients report as well. I think one thing I need to reinforce to my patients, and you know, kind of reinforce on this video, is that continue to take it. Don't just use it when you think you need it, because everybody that I see has nervous system, adrenal support that they need, and it is so restorative over time. So continue to put your self-care practices in place, you know, that sleep hygiene, especially take time to have a routine in the morning. Give yourself 20, 30 minutes to read a little bit in bed at night. Have the lights low. Nothing stimulating. Don't start checking your emails before you go to bed. Write out a little bit in your journal or read something inspirational, but try to have a routine at night that's conducive to you slowing down and settling down. And then one thing I like to do is direct my subconscious and tell my subconscious when I go to bed how it's going to go. I usually tap midline to kind of talk to my subconscious. I have this statement that I say: I fall asleep quickly, sleep deeply, and awake refreshed. So even if I wake up once in a while in the morning, I'll do that little statement to myself while I'm laying there. And there's another little technique where you can kind of curl your toes, expand them, curl your toes, expand them. I do about 5. Hopefully you don't get leg cramps, but that actually does calm your brain down too. I think in reflexology, the brain and the head are all at the end of the toes. There's something about that kind of relax, contract, relax, contract. So take your sleep formula about a half an hour before bed. Get into a nice routine. Give yourself a little intention how it's going to go, and sleep deeply and wake refreshed. Thanks for visiting us again.